So you've just come back from the vet and you've been told that your dog has to have TPLO surgery. But you're not quite thinking that you want to rush into that. You want to know your options. So today I'm going to talk to you about conservative management of a cruciate ligament injury and things to consider to help you make your decision and know that you're going in the right direction for yourself and for your dog. Hi, I'm Tanya, and this is Canine Wellness Online. So the first thing I want to talk about is what is conservative management, other than the fact that you're not doling out 10 grand and you're not doing surgery. Basically, what has happened to your dog is the knee has become unstable. So what that means is the ligament that's inside there is either fully torn or partially torn. And what's happening is your dog is getting movement in that knee, so it's unstable. So with conservative management, which I used to do a lot of in my early days, back before TPLO was a thing, in the early days, what they used to do is something called an extracapsular repair, which in my opinion, I think a lot of dogs, if it was me, I would probably do that for my dog, but that's just me. But the reason I bring this up is because with the extracapsular repair, the wire that they put in to make this not fully stable, but stable enough, what would happen over time is you would get scar tissue in there, for lack of a better term, which would help to stabilize that joint. Now, we know that the extracapsular fell out of favor, and now the TPLO is the choice for every dog. And I will say that most of the patients that I see, and I see thousands each year, do really well with TPLO. But that's not what this video is about today. So understanding that conservative management means that you're not doing surgery, so you're not repairing or changing the angle of the joint. You're waiting for this scar tissue to build in the joint so that you don't get this movement. So some things to consider. Number one, if you're going to do conservative management, you really have to make sure that your dog is the appropriate weight for your dog's size. And the reason I say this is because many dogs that are overweight are carrying extra weight, which is putting more pressure on this joint, and it's just not helpful. We also know in humans and dogs that excess weight increases the likelihood of osteoarthritis, as well as an injury there is going to increase the likelihood. So keeping that weight at a nice slim and trim weight is so important. Number two, you want to make sure that your dog is on some sort of anti-inflammatories, as well as possibly gabapentin. So the reason you want anti-inflammatories is because there's some movement in this joint. It's causing inflammation, which is slowing down the healing and causing the pain. So by giving anti-inflammatories and gabapentin, then we're addressing that pain so your dog can heal better. The third thing to consider is, and this one's a hard one, if your dog is non-weight bearing, so i.e. after, a week, 2 weeks, a month, your dog still will not put that leg down, you really have to consider something. And possibly, and I see this more often than not, dogs that really don't want to use the leg have probably torn the meniscus, which is the little C-shaped, they're not fat pads, but for lack of a better term, C-shaped cups inside this joint. I can tell you, because I did it to myself, they're very painful, because what happens is you get a little tear in there, and every time they go to bend, they hit that little flap, and it's very painful. And no amount of rehab, no amount of rest, no brace, no nothing is going to make that meniscus not hurt. Sadly, here in Canada, no surgeon will just repair the meniscus, which is very non-invasive. They will do the full repair. They won't just do the meniscus. In the US, I do know that there are some surgeons that will just do the meniscus if you don't want them to repair the ligament. The fourth thing to consider is shorter walks. So you want to have your dog on a 6-foot leash, walking with you, not off leash, no chasing balls, no playing frisbee, no running and playing with your other dog. And this restriction is going to be for a very long period of time, because that scar tissue can take from 8 months to a year to build up. And I just want to mention something here, because I did say earlier that I did a lot of conservative management with a lot of dogs, and a lot of them did really well. But what I noticed is the dogs that did well, the owners no longer took them to the dog park. They kept them on leash. They did rehab with me to make sure that the muscle was staying as strong as possible. The dogs that didn't do well were the owners that would let the dog would get better working with me. He'd be barely limping at all. And then 3 months later, they'd come back and limping again. And this cycle kept going up and down. And then after a year and a half, these same people ended up getting TPLO surgery and said, why didn't I do this sooner? And I'm not suggesting here that you do it at all. I'm just saying that there has to be exercise restriction, and probably for the lifetime of your dog. If you have a high energy, active dog, conservative management without a brace may not work for you. One of the other things to consider is doing some rehab exercises. As far as the walks go, you can take them out for 10, 15 minutes, some dogs even up to 30 minutes. The caveat here is that if your dog is more lame when you come back from your walk, it means you overdid it. And what it's really saying is the dog had too much movement in the knee, the inflammation has increased, and so there's pain. Now, if that does happen, you can use ice on the area for 10 minutes and just apply over the joint. Once that resolves, you can go back to moist heat. And I do have a video here that explains exactly how to do that. Another thing that you might want to consider is getting a knee brace. Now, this is a dicey topic for some. If your dog is quite active, I've seen a lot of dogs do really well with a brace. Now, not all braces are considered equal. If you're going to get a neoprene type brace where it has a strap that goes over the back and you have to put it on both legs, don't waste your money on that. They really are not helpful. And one of the things that two of the things that I don't like about those braces is, number one, they're soft. Like a lot of those soft braces are made out of neoprene and they don't stabilize the joint. The other part of it is they have to put it on both legs because otherwise it will fall down. It means you're restricting range of motion of both legs. And when you restrict range of motion, you're losing muscle mass. So if you're looking for a brace, you really need to get a custom brace that's made out of fiberglass where they cast the leg and make it to fit your dog. It only goes on the one leg. It has like a little metal bendy thing, really technical, but that helps to stabilize that joint. It is a bit of a pain putting them on and taking them off, but at least you know that it's helping to stabilize that joint. And you may only need to use it for a year. Some of my clients use it for the first year, and then when they want their dog to run around or play, they have it on for that. And then when they're just on walks, they don't use the brace. So now let's talk about what you can do at home for your dog that has injured its cruciate. So one of the exercises that I like to do, Ben's been waiting all day for this, getting your dog, and you're going to take your dog, here, go on the mat because I know it'll be in the film. So you take your dog and you lift good leg, bad leg, front leg, back leg. So like you're wiping their feet after you've been out in the rain or whatever, in my case, out in the snow. The reason you're doing that is you're getting them to shift their weight around so that you're ensuring that they're using the muscles of the bad leg. And while I'm on this topic, I want to give you a tool that you can use to see if your dog is improving. Because remember, they have 4 legs and they sometimes can really hide that lameness from you. So what I want you to do is when you first start this, come here, buddy boy. Good boy. Good boy. You stay there. So if this is the injured leg, when you go to lift this leg just back a bit like that, it's going to be light as a feather. Then when you go to lift the good leg, it's going to feel like a brick. Now, if it's fairly easy to lift up, it means that they're putting a fair amount of weight on this. So what you do is right after you watch this video, just test and see how much weight they're putting on. If it feels like it's equal, bonus. But what you can do is as you're going through the conservative management process, waiting for that scar tissue to build, you can keep maybe once a week testing and seeing, is my dog putting more weight on that leg? The other exercise I want you to do, and this one's a really good exercise, and if you've ever watched any of my other videos, I am like the sit to stand queen. So what I want you to do, and in terms of repetitions for this exercise, I don't want you doing more than 3 sit to stands. So what you're going to do is get your dog to sit. And what you're going to notice, if this is the bad leg, the right leg is the bad leg, he's probably going to be sitting with that leg out. And I don't want you kicking it in. But what you're going to do is when they're sitting, sit, is you lure them and get them to stand. Sit and stand. Sit and stand. As your dog starts to recover and the knee is more stable, hopefully that leg will start coming back in and closer to the body. The other thing to watch out for is placement of the front feet. So if it's the right leg, often you're going to see this foot is going to be here and the good leg, it'll be here. And the reason it's like that is because they're using this foot to help them get up. So by looking at your dog and seeing that they've got their feet more in front of them and not towards the bad leg, you know that they're starting to use that leg more. And the reason I love this exercise is because it works, come here, Ben. It works their glutes, their quads, their hamstrings, and those are all the muscles that start to atrophy when your dog is not using the leg well. And the last thing is, if you can find somebody that does rehab in your area, you could use the underwater treadmill, or somebody that's really good at giving you some exercises to do at home, or you can call me, I can give you exercises, or also getting someone to do low-level laser on your dog's leg. The reason I love laser is because it speeds up the healing process. It gets rid of some of the inflammation as well, as well as releasing endorphins, which is the feel-good chemical in your body. So those are some of the things that can really help your dog do well with conservative management.